Assalamu alaikum. In this lecture, I will talk about hypertension. Hypertension defined as a persistent or consistently elevated blood pressure to a level of 140/90 or more. So, blood pressure between 120 to 140 consider pre-hypertension. So such patient also need lifestyle modification and follow-up because the ideal blood pressure is 120/80 or less. Blood pressure can be classified into different groups according to severity of hypertension, according to severity of blood pressure, into mild, moderate, and severe hypertension, as you can see in this table. Regarding the epidemiology of hypertension, hypertension is very important health problem. It is worldwide health problem. However, most of the patients are asymptomatic. That's why it might be labeled as a silent killer. Hypertension, if left untreated, can lead to lethal cardiac and neurological complication. On the other hand, if it is easy treated disease if the patient compliant with his treatment. Hypertension increase in prevalence of hypertension increase with age, and it has been found that more than 50% of those above 60 years have hypertension. Female slightly is more affected than male. Regarding the etiology of hypertension, about 95% of hypertensive patients have no clear cause for hypertension and is called essential hypertension. The remaining 5% have certain underlying cause and called secondary hypertension. The etiology of essential hypertension is probably multifactorial. It means there are genetic factor, genetic susceptibility, plus environmental factor like high salt intake, high alcohol consumption, obesity, sedentary life, and stress. All these factors might play a role in the pathogenesis of hypertension. Secondary cause of hypertension, the remaining 5% of hypertensive patients, this may be related to the pregnancy called preeclampsia, related to renal disease like chronic glomerulonephritis, polycystic kidney, renal artery stenosis, hereditary disorder like coarctation of aorta, meaning narrowing of the aorta. This can lead to hypertension even in childhood. Endocrine disorder like Cushing's syndrome, thyrotoxicosis, and lastly, certain drugs also might increase blood pressure like oral contraceptive and corticosteroid. The standard method for measurement of blood pressure, patient must be in sitting position and arm supported on the table at a level to the level of the heart, and patient must be in rest for 5 minutes before measurement of blood pressure. Patient must avoid exercise, coffee, or smoking at least 30 minutes before measurement of blood pressure. In the first visit, you have to measure blood pressure in both arms because really there may be difference in the left and right or in certain underlying cause like coarctation of aorta. If blood pressure is high, then you have to repeat the blood pressure measurement after 5 minutes because it might be elevated because of. Now, if the patient has high reading, then we have to repeat the measurement after 5 minutes because might result from stress, and it has been estimated that about 20% of patients may have elevated blood pressure measurement in the clinic compared to home measurement, and this is what we call white coat hypertension, mean due to stress of the clinic on the patient. So you have to keep this point in your mind. The standard device for measurement of blood pressure is mercury sphygmomanometer. There are other semi-automatic or full automatic devices which still the reliability of this device not well established, and recently we have what we call ambulatory blood pressure monitoring, which measure blood pressure over 24 hours to assess those with pliable hypertension, which change from time to other. Hypertension can lead to many complications on different organs of the body. On the heart, it can lead to ischemic heart disease, heart failure. In the brain, it can lead to stroke, CVA, or intracranial hemorrhage. On the kidney, it can lead to chronic renal failure, retina. On the retina, it can lead to retinopathy and visual disturbance. Also, it can affect peripheral blood vessels and leading to peripheral vascular disease. So, uncontrolled hypertension can affect many organs of the body. A newly diagnosed hypertensive patient need a routine investigation. This investigation must be done for any hypertensive patient, including general urine exam for blood, protein, glucose, assessment of renal function, assessment of blood sugar, electrolytes, and lipid profile. Also, you need ECG, ultrasound of the abdomen. Other investigation depend on the other finding, so not done routine in any patient. Like for example, the Doppler study of the renal artery, if there is suspicion of renal artery stenosis, assessment of endocrine function when there is suspicion of Cushing syndrome or thyrotoxicosis, and so on. Treatment of hypertension include non-pharmacological treatment and pharmacological treatment. Non-pharmacological treatment include restriction of salt intake, restriction of alcohol intake, regular exercise, control body weight, very important. Even mild reduction in the body weight can lead to a reduction in blood pressure. And lastly, increased consumption of fruits and vegetables. Regarding the antihypertensive drugs, we have a large number of antihypertensive drugs which can be classified into following groups. First group, diuretics like thiazide, furosemide, angiotensin converting enzyme inhibitor like captopril, enalapril, lisinopril, angiotensin receptor blockers like valsartan, candesartan, calcium channel blockers like nifedipine and amlodipine, beta blocker like metoprolol and tenolol, and other drugs like prazosin, which are alpha blocker, hydralazine, direct vasodilator, and methyl dopa central acting antihypertensive drug. Regarding the regime of treatment, which drug will choose for this patient? As a first-line treatment, you can use any of these groups, including diuretics, angiotensin converting enzyme, angiotensin receptor blocker, or calcium channel blocker. Anyone any member of the first four groups can be used as first-line treatment. If the patient not respond, then we can use combination of drugs. Beta blocker can be added later on, or if there is associated ischemic heart disease, then beta blocker can be considered a first-line treatment. What is relevant to you as a dentist? As you know, any surgery, including dental surgery, increase the stress of the patient, so it can lead to elevation of blood pressure, particularly in poorly controlled hypertensive patient. In addition to that, using of adrenaline in the anesthesia, this can also aggravate blood pressure. So you have to check blood pressure in hypertensive patient and in any adult patient, because might be undiagnosed. As we said, most of the hypertensive patients are asymptomatic. Also, many hypertensive patients use aspirin as primary or as secondary prevention for ischemic heart disease. And as we said, aspirin cause platelet dysfunction and might lead to bleeding after tooth extraction. So you have to ask the patient about use of aspirin and stop it for 5 to 7 days before surgery. Then later on you can use it again. Other problem for dentists in hypertensive patient might present to you with gum hypertrophy, and this side effect can be induced by a specific antihypertensive drug, which is the calcium channel blocker, particularly nifedipine. So in this case, you have to reassure the patient and change the antihypertensive drug in cooperation with a physician, and this complication is usually reversible. And thank you.